Fabry's is a very variable disease, but for those who have it severe enough to need ongoing specific therapy, then the current standard of care for over a decade has been enzyme replacement therapy, either with Fabrazyme or Replagal. The advent of chaperone therapy was a great boon for those who didn't want the inconvenience of intravenous infusions and the dangers of infusion reactions. And for some people, the development of neutralising antibodies, which undoes the effectiveness of the process. But the chaperone therapy was only really applicable to 40% of people who have amenable mutations. So this is where the development of, firstly, substrate reduction therapy, applicable to everybody, irrespective of your gene defect, has been an interest, but that's still unproven, and we're waiting for the results of the placebo-controlled modifier study. And secondly, the development of gene therapy, which offers the opportunity of a one-off therapy that potentially can give a lifelong supply of enzyme, and if it's carried within stem cells, can cross the blood-brain barrier and get into so-called sanctuary areas. We still don't have good therapies to protect and treat the future generations, and that'll hopefully be the next great leap through at some point. So for gene therapy, monogenetic diseases, it's a really exciting opportunity to provide a one-off cure, and with the lentiviral vector that's used by AVR-RD-01, this provides an insertive and replicating therapy. The particular technique that we've been part of is an ex vivo, which builds on the very standard hematological technique of autologous stem cell transplantation. It does require a myelosuppression, not a myeloablation, so there's a brief window of hematological risk. But we've been very impressed by the results in our study so far, out to 3.5 years of follow-up for patients both who have either had the therapy on top of existing ERT in a phase 1 study, or as de novo therapy for treatment-naive patients in our phase 2 study. The exciting data that we've presented shows that in the phase 1 study, when you already have patients on standard of care enzyme replacement therapy, that you can achieve a nearly 30% further reduction in their accumulated substrate. And in patients who are de novo treated, it's a full 70% reduction in substrate. And this is not just in the plasma, but if you then look at the organ of interest, and we've got paired kidney biopsy data, then you can see in our first patient that we presented at World last year, we achieved an 85% reduction in endothelial substrate levels. And for our second patient with paired data, it's an absolute 100% clearance. So this is very exciting, with no evidence of any toxicity directly related to the lentiviral vector platform, or, interestingly, any development of antibodies. If anything, there is suppression of pre-existing antibodies, possibly due to the adjunctive myelosuppression.